before the last Christmas. Okay, before last December. On that table, I think before that, even before that. Last 6, 7, 8 months, yes. It is those things, they put it back in the trolley. If you Google crash trolley, you will have a look at the trolley. Because now it is little bit problematic. You have to pull the trolley drawers and you need to check the things. They usually label outside. Sometimes they label as ABC. The first trolley is for airway, breathing, circulation, some medication and something. Sometimes it's just everything labeled, what is inside. Why I started talking about the trolley is, now wherever we were talking about airway and breathing, when it comes to breathing, yeah.
The boxes, one must be a needle and one is a strip.
This one, yeah.
Needle and one is
The strip, strip. This is strip. This is the
what is
strip.
the big one?
That is a glucose tab. Glucose has a tablet. You put it in the mouth, it's the solvent, it's sugar. Sugar, yes. All right, let's go back to our business now. Okay, yes. All right, good. So, that is, so in terms of now breathing, what we did, we look at the monitor. We talked about the finding, okay, which is saturation is this and breathing rate, respiratory rate is like this. What I would like to do, your intervention is, I would like to give high flow oxygen via non-rebreather mask. Now you will walk into the trolley. You have to open the drawer, pick up the right mask. There may be different masks. Okay, you may find a different mask. You will have a normal oxygen mask. You will have a Venturi mask. What is in the Venturi mask? Venturi mask is color coded with a different concentration. You need to reduce less than 100. Okay, you'll have a different mask, this kind of different mask. This is the non-rebreather mask. I will show you another video how to put a mask as well. This is Venturi mask. This is an ambu bag, basically. You have this normal oxygen mask. You need to, okay, this is the non-rebreather mask with the kind of green color lining. You pick up the mask. The mask, the other side is not connected to oxygen or anything like that. You come near to the patient now. You speak to the patient now. Mr. Johnson, your oxygen level is quite low. So, therefore, what I would like to do is, I would like to give some oxygen through this mask. I'm going to give you high flow oxygen. So, I'm going to put this mask on your face, and you have to put the mask on the patient's face. You have to do it. And you have to pull and tight it. I'll show you the video how to do that. After putting the oxygen, ask the patient, how are you feeling now? Look at the monitor. If the monitor is improving, talk about it. Okay, saturation is improving. So team is aware it is working. Saturation is 97, 96. Oh, it has come to 94. So earlier was 92, 89. It's 92 now. It is improving. Here it is talking. Yes, it's a talking. When again you also talk. The other scenarios you don't really talk like this. Because here is demonstrate your knowledge and skills, how to assess, how to identify, how to take action. Okay, it is a kind of robotic here, okay? My patient saturation is improving. Okay, it is 96. So I told you, you are not alone. Imaginary team. Team is there, they know, okay, it's working now. Or if it's not working, we need to move into other steps. So breathing assessment is the theme. Our aim is oxygenation and ventilation. So you have done the oxygenation now. You need to check the ventilation. How to check the ventilation? You need to examine the patient's chest. Inspection properly, IPPA. Only the chest. Inspection, palpation, percussion, auscultation. That's what we learned about. Once you have done this, or when you do the inspection, so you need to do inspection of the chest. Patient is fully clothed now. Patient is on the couch like this. So what you need to do, you need to tell the patient what I would like to do. I would like to examine your chest. So I would like to expose your chest. Okay, you can mention the chaperone, provide you with the chaperone. Okay, then do you need any help with exposing your chest or undressing? Talking mannequin cannot do the undressing. So you have to undress, unbutton, open up. Okay, if it's a female mannequin, okay, they will have underwear as well. Leave the underwear. You know, now you open the chest, have a look. If you find something, take action immediately. What you may find. What you may find. Rash, anaphylaxis. Okay, if you see a rash, immediately say, I can see some, okay, some rash. If it's a urticaria, I can see some urticarial rash. You have already seen the patient. Patient is receiving the blood. Patient is receiving the blood. I'm going to stop the blood. Stop it immediately. So every action should have a reason. Okay, in anaphylaxis, as soon as you walk in, if you stop the blood, that is robotic. People usually ask when we stop the blood. This is the point you stop the blood. Okay. So inspection, palpation, percussion, auscultation. When you auscultate, you get some abnormal sound, like you hear wheezing. What you gonna do? Excellent. You need to tell that outside. If you don't tell, it will go with you and you will die with it. Okay? Yes. You need to tell outside. I could hear wheezing. So because I told you, you are the one doing the assessment. You are the one listening to the patient. So there's wheezing. Tell the patient you're wheezing as well. So we may have to give you another medication called salbutamol. You have to give salbutamol nebulizer. This can happen in anaphylaxis. This can happen in asthma. Have you done with breathing now? Have you done with breathing? Not really. You have to verbalize how will you complete this breathing. So breathing, complete the breathing assessment with ordering, ABG and chest X-ray. Team can do. I would like to also order. Okay, ABG and chest X. Now, breathing is done. Circulation now. Let's see how to assess, how to intervene. So the first step is looking at the monitor. What is the theme? What is the bottom line? Is the blood pressure. If the blood pressure is normal, optimal, then, okay, in terms of circulation, it's almost okay. But theme here, for the breathing, circulation is arrest bleeding if it is a trauma and maintain the circulation, perfusion. Maintain the perfusion. Okay, if it is a bleeding or blood loss, that means circulation can collapse. Or if it is a shock, vascular collapse. Okay, both can affect the perfusion. So, it's no trauma now, so just it's hospital medical related. So first thing you look at the monitor in terms of circulation. Look at the blood pressure. Talk about it. Tell your finding. My patient's blood pressure is 110/70. There are three things you're going to check in terms of blood pressure on the screen. Then, what is the next thing? Heart rate. Okay, patient, okay, heart rate is, if it is more than 100, patient is tachycardic, or heart rate is 135, or tachycardia with 135, 120, or bradycardia means bradycardia. What is the third thing you check? What can compromise the circulation? No. Irregular rhythm, arrhythmia, ECG. So talk about ECG. ECG shows normal sinus rhythm or sinus tachycardia, atrial fibrillation. You have to say it. That is done. In terms of circulation, you can take one immediate action as well. If it is anaphylaxis, you can start talking about the treatment. The main treatment is adrenaline, for example, to prevent the collapse. You can start with adrenaline if it is an anaphylaxis and there is a circulatory collapse. Actually, if it's anaphylaxis, you need to call for help as well. We will talk about it. But you can start with medication. If it is not an anaphylaxis, the first thing in terms of circulation is putting an IV line. So that means I would like to secure, you speak like this, I would like to secure large bore cannula. If its blood pressure is really low, let's say 69 or 70, 72 systemic blood pressure, systolic blood pressure, you put 2 large bore cannula. It's slightly low, like 100, 99, 92. But depends on the pathology as well. Okay, you can put 1 large bore cannula. Blood pressure is normal. Are you going to put a cannula? Yes? Yes, of course you need to put a cannula. Patient is not well. If somebody get admitted, what the nurses will do first thing? They put a cannula. Okay, yes, you put a cannula. You put a cannula. You can also would like to give, if its blood pressure is low, you can start giving, okay, saline. Okay, you can give 1 liter stat, which means 15 minutes stat. You can give 2 liter, 15 minutes stat. Or you can give maintenance fluid, which is 1 liter over 6 hours. Sorry, 12 hours. A pack is over 6 hours. Okay, 2 liter for 24 hours. That is the maintenance fluid. When you put a cannula, from the same cannula, you take the blood for all the analysis. What sort of analysis? You can start with maybe urea, electrolytes. clotting factor. Okay, sometime blood culture. So all the baseline blood test, cross-match, send the blood. Your circulation will continue. Assessment. Your circulation assessment will continue. We can do it other way as well. You finish the assessment and do the other thing, but putting a cannula should be early as possible. Okay, yeah. But the cannula insertion also come with the taking the blood from the same cannula. When you insert a cannula, blood will come, you take the blood. You continue with the assessment of the circulation. You assess the hand. There are 4 things you can assess on the hand. First thing is temperature. You just touch your patient's hand like this and you have to say it. Okay, peripheries are warm. Peripheral temperature. Look for cyanosis. There is no any, okay, cyanosis. There's no peripheral cyanosis. Check the pulse, radial pulse. It could appreciate, could not appreciate. Normal volume, regular, irregular. Who is this scribbling on my screen? And also it's not relevant. So you are not writing your notes here. Okay. What is the 4th thing in terms of circulation? Capillary refill time, CRT. Capillary refill time is 5 to 2. That means you press it for 5 seconds and you have to refill within 5 seconds. The next thing in terms of the circulation, you can check radial to radial pulse as well, but it's not really that important. The next thing is listening to the heart. Just listening to the heart. That is the end of the circulation. If okay, nothing is, if you haven't mentioned about the blood, you can mention now, finishing this. Okay, if you haven't mentioned about the fluid, you can do it after just the hand and the heart. I would also like to, this is all demonstrating is speaking, okay? You have to say it. So, you have to finish with sometime full lead ECG in terms of circulation. Right. In terms of, so let's say that you have to put a cannula. So if you have to put a cannula in the circulatory assessment, it is not just saying it, also you need to work to the trolley, pull the trolley, take the appropriate color cannula, and you need to come near to the patient.